Yeah, we've been very active in the dialogue about kind of how can we ensure that there's healthcare currently for the people in the Ukraine, but also how can we strengthen the system coming out of the conflict. And we've been talking about how we can, in the occupied territories, rebuild a hospital. We have spoken specifically about the Izium hospital, and we already have a joint effort, also together with the government, with the Ola Zelensky Foundation and Philips, to kind of make sure that we build that hospital in the latest and with the greatest technology, digitized, so that kind of we can give broader access to the people in the Ukraine.
That is something that's jumped out from all of my conversations with Ukrainian ministers, that every time there is a rebuilding, it is better than before, that it is fit for the future. What sort of digitization are you seeing in some of your endeavors that they haven't had before?
Yeah, we're really looking at kind of how they, because there's shortage of staff, because they need to redo and rebuild a lot. And what technology can we bring to bear in the hospital so that they can see more patients, that actually their productivity in the hospital is at the highest level. And that's where they can apply some of the latest technology to do remote monitoring of patients across the regions in Ukraine, but also in the hospital system, how they can predict certain diseases better, how they also get the patient flow as efficient as possible. And as you can redesign a new state-of-the-art hospital, you can really take the latest workflow and the AI that you can apply in those workflows now into bear for kind of coming out actually stronger and better, with better care for the patients after.
I want to talk more about AI. I know you made an acquisition last year in imaging, and there have been a ton of announcements from what the capabilities are about. But in terms of the conversations you've had here in Davos around AI, what's the context of those conversations?
Yeah, I think everybody sees the potential. I think there's an eagerness to see impact of AI. So how can we make sure that actually it currently lands in the day-to-day practice? And I think in healthcare that is actually possible, because a lot of the AI development that has been going on in last year was really about what are the specific problems that we can solve. If you need to schedule patients, how can you do it more efficiently? If you need to do a first scan, how can you actually have AI help you to do that in the best possible way? If you're at the ICU, can AI actually help predict an event from happening? If we send people home, can we actually put them on a monitoring where actually with AI and a whole system, we can make sure that they don't fall back and we need to pull them back into the system. Next to that, we also talked about the responsible application of AI, because as we are here together with kind of governments, with the industry, with the tech partners, we're looking at a responsible application, because there are risks. You need to be open that also those need to be managed, and that means that kind of you need to put forward yourself as an industry kind of what are the responsible ways to apply AI in the daily practice, so actually that the benefit goes to the patient, goes to the healthcare system and the governments. So that's something that is also being spoken about, and generative AI gives a lot of new possibilities. You need to train the model in the relevant way so that actually the clinical outcomes are well tested, are validated, and you actually make sure that it does what it intends to do.
The last 2 points really take us to the territory of how do you train the AI with the right material and where do you get the data? Last year in Davos, I was talking to Chinese developers and they were using data sets from everywhere. Is that spirit of collaboration available in the West, or are there still silos in accessing the data?
So it's a very important question, and unfortunately we do still see silos. I think the data landscape is not yet fully unlocked. So that's also something we have been discussing with the regulators and with the governments to say what is it that we can do to accelerate the availability of data. And you can actually de-identify them so that actually there's no tracing back to the individual, so that also you make sure that kind of there are no side consequences of that. But we need to get to better sharing, faster sharing, because that actually makes the algorithm learn, that actually makes it to be as effective as it can be. And that's something that in the whole journey of AI, we're not there yet. I think it's as important as the algorithms itself that we have the right data. There's a lot of progress being made, and people are very much currently attuned to what is it that we need to work on together, but the regulation has to then fall in line. The privacy parts has to be protected on one side, but also kind of make sure that kind of we can work with the data. There's a lot of progress on individual level. If you look to hospitals that we work with, certain countries that we work, so progress is being made, but it is a barrier that we still need to kind of make further progress on.